Good evening. You are with the Urban Debate tonight with me, Sahar Zaman. We're making a start with what's being reported in Pune. It is the worst nightmare of what you can imagine, and this is actually playing out in Pune as we speak. Pune, if you haven't noticed, the total number of positive cases has surpassed what Mumbai has ever reported. It has surpassed what Delhi has ever reported. Currently, the figure that we have for Pune is 1.86 lakh positive cases. Over and above the load of cases, there is an absolute collapse of health infrastructure. The state government, the local city administration had promised jumbo facilities that would be prepared. Out of 3 of them, one is operational. One has been operational, but it is under a horrid situation here because as many as the beds that were promised, not there. ICU units, ventilators, not enough. But more shockingly, there aren't any doctors. Currently, the jumbo facility has stopped taking patients because there are no doctors to cater to the patients. Not just that, even the death toll at this very jumbo facility, which is called the COEP, has climbed up to 27. The authority has finally got a rude jolt to that. It has now promised that there are going to be officers on duty 24/7 to monitor the situation. But the question being asked here, what will they monitor if there aren't facilities? More importantly, if there aren't doctors? Does this expose the sham of what has been called preparedness time and again? And is there still time for damage control? Let's talk about that tonight. Let's bring out our concerns for the city of Pune. Our guests, our panelists with us tonight. We have Mr. Mahesh Tapse, who's the spokesperson of the NCP, Dr. Shashank Joshi, who's the Dean of the Indian College of Physicians, Leelavati Hospital, and also a member of the COVID-19 task force. We also have Dr. Abhay Shukla, who's the national convener for the Jan Swasthya Abhiyan. And we have Mrs. Sheetal Raikar, who's the wife of the deceased, Mr. Raikar, the journalist who was reported dead from this very jumbo facility. We're coming to you first, Mrs. Raikar. We are so sorry for your loss, and we are so grateful to you that you have been available here to us to speak about this, in putting your grief aside and in coming here to speak about the larger concern which other people in the city of Pune would face as well. In your view, has this essentially happened because the jumbo facility was not providing the treatment that was promised? People are walking into jumbo facilities as a preference because the government has spoken so much about it, but what's really being provided on ground is barely nothing.
Hello, hello, hello.
Sheetal Raikar, can you hear me, please? Please go ahead.
Yes, ma'am. Yes, ma'am.
Mrs. Raikar, this is a very difficult time for you here. Do you feel that your husband passed away primarily because of the facilities that were provided at the jumbo facility were not enough? There was no proper treatment that
Ma'am,
was given.
no, no proper treatment, miscommunication, damage system, and of my husband is victim of this system actually. He has passed away.
That is a very strong statement to make. Yes, saying that
He
your
has
husband has
passed
been a
away,
victim of the
and
system.
it's
But if you could,
ma'am. He hello, ma'am. Hello.
yes, please go ahead.
Ma'am, we we were told we thought to shift to we have decided to shift to Dinanath, okay, but we didn't got a cardiac ambulance over
Hmm.
there. We didn't receive a cardiac ambulance, nor a doctor was arranged, and they insisted, actually they forced my sister-in-law to sign the high risk form, but she said that I will sign it, but please provide a cardiac ambulance first, okay, and doctor in it. But they were but it was unavailable. And even the tiffin, actually we had inquired before a day that can we provide a tiffin from home. They said yes, you can provide. My sister-in-law, she went there and she has given tiffin also, but that tiffin was also not reached. He had WhatsApp me and my sister-in-law that please provide me tiffin, please provide me tiffin, but the tiffin was not reached. He was simply angry. And if a person is unconscious, can he say that he is hungry or bring tiffin for me fast? He was really okay that time. When we had a video call also with him, he was okay. He was fine. But I think it is totally in ignorance of these doctors at COVID center. And this is not at COVID center only. He came to me to meet me at Kopargaon, and before that he had tested his corona. It was negative on 26th, I think. Then he came to Kopargaon. There also the same thing happened, only for rupees 40,000 rupees. They said first please pay the amount and then we will admit. It happened with me in Atma Malik Koparga also, and here also. System damage, total system damage. And my husband, he has to message his colleagues from TV9, ABP Maza, everyone were there for him. Everyone were there. He has to message that please, I am feeling very sad and please let me just pick up me from here. That is very sad for us. And ma'am, one more thing, that we were all always online on WhatsApp. That okay, he will come online, he will talk to us, he will have a video call. That is very horrible. That a patient's relatives, they have to be online. All we were online. Okay, he will come online and he will talk to us. This is simply horrible. I think there should be a display screen outside for patients relatives to see whether their patient is conscious, unconscious, he is provided ivs, fluids, foods or not. It should be there. If they are building a huge COVID center with lot of crores of rupees, can't they have a display screen outside? This we have faced over there. And and my, my now my husband is not going to come, but at least other common people, they will not face this problem, and they should not face it. And I'm feeling that pure soul, when he was
Right.
alive, that time also he helped everyone, and after he went also, still also he is helping everyone in this crisis. I have two children, how I will face them, that is more a big question in front of me. One is 5 years old and one is 2 years old. They are at Kopargaon and I am here in quarantine in Srigonda. What answer I will give him? He is asking me every day, how is daddy? When you're going to bring daddy? When you're coming? Please come fast. What I will answer him? He's just 5 years old and my 2 years daughter, she is too unable to understand. What shall I do? Is this system going to bring him back? No.
Mrs. Raikar, you have been so brave in speaking with us. We are so terribly sorry for your loss here. And you've been brave because you're speaking out in helping improve the situation. You're hoping that this case can make a difference in improving the situation for other people in Pune. We are so grateful that you're speaking with us at this time. Let me directly take in a response to what you've just said here from Mr. Mahesh Tapse, spokesperson of the NCP. Mr. Tapse, please respond. These were very grand promises. Jumbo facilities, one was constantly reading about it in the news. We were constantly reporting about it on ground. It missed a few deadlines of being prepared in time. Even that could have been forgiven. But now when one of this jumbo facility is ready, This is how bad the situation is.
Good evening, Sahar and all panelists. My heart goes out with my dear friend Pandurang Raikar, who just left all of us. Being a very nice journalist, he would update us on lot many things. It's been almost 6 months that I haven't visited Pune, but yes, we definitely always feel the void that Pandurang has left, and I pray that his soul rests in eternal peace. Now, coming back to the facility, in Pune, I'm sorry to say that we are all taken this very negatively. We are shocked. We don't have words to say why such a thing is happening. Our guardian minister, Mr. Ajit Pawar, who also happens to be the deputy CM of Maharashtra, has taken great and Herculean efforts to bring two jumbo hospitals in Pune, one out of the funds by the state government and other by the funds managed by the CSR funds. Now, what is happening on the ground after Pandurang has left us all? We are getting feedback from the people that the local. I see now. I don't want to play a blame game. There were two senior panelists who are also medical professionals on the debate itself. But I would want to would want to emphasize over here that state government alone can only create an infrastructure. Running the infrastructure may 100% not be within the purview of the state government. I'm told today that some letter from the PMRD commissioner has gone to the municipal commissioner that certain things need to be corrected on ground. Within the municipal limits of Pune, certain thing needs to be corrected. This is the letter which I am told today. I have not seen it, but I'm told a letter by the PMRD commissioner has been shot. I appreciate the concern that Mrs. Raikar has given to all of us. I'm sure that the suggestion that she has put forward and the expectation that she and along with all the families of the patients who are there within the facility put forward to the state government and the
Okay,
municipal corporation of Pune will be taken in a very
we
positive
got your
note.
point. Mr. Tapse, we got your point here. But when you say that you have no words to explain how this happened, or if you're trying to indicate these are teething issues, this is
No,
really
I'm not.
unforgivable. And I'm sure Mrs.
I'm
Riker
not
wants to come in
saying.
at this
No,
point.
no,
Mrs.
sir.
Riker, please go
No, sir,
ahead.
I'm not.
Mrs.
Sir, I'm
Riker,
not
please
saying
go
this to
ahead.
issue.
We want to hear
Sir,
you,
you
a
are.
response to what has come from the NCP spokesperson.
Here you are getting me wrong. I did not
No,
say it's a teething issue. I did not mean it is a teething issue. I have said that it is very shocking to learn that this is the state of affairs happening in that particular place for which certain agencies are responsible.
Absolutely.
Now, who
No,
those
but we are
agencies are,
equally shocked to hear a member of the state government saying that they are shocked about this.
see, I am here in Mumbai. I'm
It
not staying
takes
in
so many
Pune.
deaths.
I'm here in Mumbai. I'm
It
not
takes so
staying in
many
Pune.
deaths for no, it takes so
No,
many
I am
deaths
staying
here
in
for the
Mumbai. I'm not
government to
saying you
get
are
into this
saying
jolt and a shock. Mrs. Riker,
I'm
please
not
respond.
Mrs. Riker, please
Respond.
I'm going to be only
Mrs.
I'm going to
Riker,
be
please
only
respond. Can we please be silent for Mrs. Riker here?
Yes, ma'am.
कितना time बोला
I couldn't hear you. I couldn't hear you. Hello, hello.
Mrs. Riker, when we have Mr. Mahesh Tapse saying that
Hmm.
that they are going to look into this, they can't imagine why this has happened here. What is your response to this? I mean, things should have been
This
absolutely ready once things have opened up.
yes. It when it was opened up, there was they there were like what I'll say. They haven't there were no enough staff, no enough medicines. Why no cardiac ambulances also over there. When I went that time also they said me no, your bed is not booked, you just go out. Actually Dr. Margade from Wipro COVID, he had booked a bed over there. He said you go over there. They simply said hey क्या है ये क्यों गाड़ी अंदर लाया चलो चलो निकलो बाहर. He was not ready to listen also over there. That time I was alone with my husband. From Kopergaon to Pune I was all alone with my husband. I didn't thought that okay I will get corona positive or what. I didn't thought that time. That time for me it was important to admit him, just to admit him. There also he did a time pause of 1 hour. At Koperga also 3 hours. Here literally 1 hour. and then they are admitting. What is this? And literally the
That's
staff
right. Dr. Joshi,
staff
please
was not
respond to
enough.
this. I would like to ask you this as a member of the COVID-19 task force here. Dr. Joshi, why do you think this has happened? Because we do not want to listen to a blame game between the state government or the Pune district authority, the municipal authority, the development authority there, blaming each other or putting it out on the private agency which was outsourced for making things ready. Why do you think this has happened? The facility should not have opened up if things were not absolutely ready up to the mark.
I think I completely agree with you, and my heart goes out to the Madam Raikar. I think this is a very sad moment. I think if the infrastructure, communication, and the facilities are not up to the mark, they should not be functioning in the first place. And I think what she had to go from pillar to post is something which we saw early in the pandemic in Mumbai, somewhere in early April. And that was also very tragic and sad that patients used to go from pillar to post and many lost their lives. I thought that we could get a wake-up signal from there, and this is never repeated again in any other part of India or planet Earth. Unfortunately, I see that after almost 4 months, we are just back to square one. And this is very, very painful and very, very sad. And I think, there is no excuse for anyone in that facility. If the facility was not, if they can't provide basic food, basic oxygen, basic medical care, I think the facility should not be there. These are not cosmetic facilities. These are healthcare facilities with oxygen beds, with ventilator care support. And what is minimum required is actually to have ambulances, because you can't have, the lack of availability of an ambulance. So I see that right from Kopargaon, from where they hailed from, to coming there, at each point there was a hardship. And this hardship is unexcusable. And I think we have to mitigate it. Every life is important and we need to save lives. COVID is here to stay, but we need to do infrastructure building, and we have to ensure that when the infrastructure is built, it's just not a brick and mortar. We have to have every facility, right from communication to food, to healthcare facility, to oxygen, to ventilator, to doctors, everybody to be there in place. If somebody was not, if he was serious as a patient, he should have been straight moved to a bigger hospital facility, independent of his economic status. And that's the least we can do for our own citizens. I'm extremely sad and pained with this whole episode. And I think there is no excuses for all this.
But where has our learning been? Dr. Shukla, would you like to come in at this point? One would have thought to expect better from the Maharashtra government. They have lived through what Mumbai has seen. They have the Mumbai experience. Why is that not being translated to be used positively for Pune? How could this collapse so badly?
Yes, actually what Mr. Pandurang's family had to face, Pandurang Raikar's family has to face, is something very, very tragic and very, very sad. And it was perhaps avoidable, and that is why it is especially tragic. And we need to see first of all, what is happening in this jumbo facility. Now, when the jumbo facility was set up, the dashboard was showing that there are 800 beds which are available. And it was a little suspicious, because when patients were being referred there, our organization is running a helpline for COVID patients. And when patients were sent there, they were often told that no beds are available. Now, suddenly today, if you look at the dashboard or the official dashboard, it shows only 300 beds available in the jumbo facility. So from 800, suddenly now it has declined to 300. 500 beds have evaporated. This is a big question mark. Who is going to answer this? Where have those 500 beds gone? 80 crore rupees of public funds have been sunk into this jumbo facility, and 500 beds are missing at the time when they are most required. And obviously, as Mrs. Raikar mentioned, ambulance facilities are also not available. Basic, facilities for transporting patients were not available, and which is what led to this very unfortunate death. And next, we need to see that now it has been asked that the Sassoon Hospital, which is a public hospital, has to transfer 70 ventilators to the jumbo facility. This is actually extremely questionable. So this actually tells us what is the problem. Instead of strengthening our own public health facilities and expanding them, we are handing over the responsibility to unaccountable, contracted out these kind of providers which are failing the patients
right.
and the.
No, Dr. Shukla, I'm going to take this point that you've just raised with Mr. Tapse in just a bit, but very quickly, because you're talking about the flashboard here, which gives the status of how many beds available, how many occupied. Right now, even that is not helpful. This jumbo facility has already shut down because doctors are not available to handle more patients.
Yeah.
And
where will the doctors come from? There's no flashboard talking about doctors.
There are no ventilator beds available in the city of Pune. There are just 2 ventilator beds. And whereas the number of patients who require ventilator beds is in the range of 500 to 600 patients at any point of time. So it's actually like a jumbo disappointment, because what was supposed to be the solution to the problem has collapsed. It has proved to be a complete non-starter, and now patients are left in a lurch because we have not even strengthened our own public hospitals. We do not have a single ICU bed in any of the Pune Municipal Corporation hospitals. Pune has a large number of corporation hospitals. Not a single ICU bed is available there, which has been a demand since many years actually, that hospitals like Kamala Nehru Hospital should have isolation beds, they should have ICU beds. That has not been expanded. Sassoon ventilators are being shifted to the jumbo facility.
That's right.
And the jumbo facility has effectively collapsed. So this is not the direction through which we can deal with this epidemic in Pune, or for that matter anywhere else in Maharashtra. We have to strengthen and expand our own public health facilities rather than handing.
Mr. Tapse, talking about doctors here, the availability of doctors, which has now undoubtedly been established. This cannot further be argued that doctors are available. Doctors are not available because your jumbo facility is shut down today as we speak. This is a jumbo facility which has already reported 27 deaths. It has shut down for lack of equipment. It has shut down for lack of health manpower, lack of doctors. Where are you getting the doctors from? There is a statement from the IMA, independent individuals who used to be with the IMA, saying that the IMA had proposed providing their doctors to dedicated government COVID-19 centers. Why was that shot down?
See, let me tell you, as a government, the job of the government or the health department or the guardian minister would be to facilitate the establishment of a jumbo facility or some kind of a isolation facility. See, I'm not a doctor, so please excuse me for my non-technical terminologies. But yes, the guardian minister did make effort, and he could set up 2, I think, jumbo hospitals, one in Baner and the second at COEP in Pune, in the College of Engineering in Pune. So he has set up over there, and I don't know what dashboard Dr. Abhay Shukla is talking about. I don't have access to it, so I wouldn't really comment. But the facility at the COEP is about 300 beds, which I am told today. And yes, there were issues right from the beginning, but at that moment to start up the hospital was one task. It was started on a positive note. A lot of publicity was given to it. Unfortunately, it did not go down that well that we expected it to go well. Now there are 2-3 major reasons why the sudden spike in Pune specifically. So when today in Mumbai we have over 21,000 active cases, we have 54,000 active cases in Pune itself. Now I would like just show you one small example. Pune has collected a fine of 1.1 crore from people who are not wearing masks or who are not following the norms stipulated by the government. Whereas in BMC it is only 27 lakhs. So yes, we as a government, we have a responsibility. The municipal corporation has its responsibility, but also the people who are suffering from the disease or who are more prone to get infected also have a responsibility to protect themselves.
No, but Mr. Tapse, this is gross negligence. This is gross negligence at the top of the pyramid from the state government. We can go along blaming the Pune district administration later, but this is a top responsibility of the government. The government is providing the taxpayers' money for the construction and running of this facility. 80 crore rupees of the exchequer spent on this facility.
Since Dr. Shashank is in the COVID team, I'm sure he has a much better insight on all these things. He needs to tell us who is in charge of the jumbo hospitals in Pune, in COP, whether it's the municipal government, and what are the lacunas. We'll definitely try to get
let's
it sorted.
ask Dr. Joshi that. Dr. Joshi, where are the doctors going to come from?
So let me be very transparent.
Dr. Joshi, can we get a better sense of where the doctors will come from, please?
So actually, this is a thing which should have been anticipated and provided for. We are only drawing some protocols for treatment to improve, save lives, etc. There are three issues which I want to highlight. Number one is that if the healthcare facility and the people were not there, the facility should not have been opened in the first place. So that people like Mr. Raikar never landed up there and went to a facility where care was provided. So if you don't have people, personnel, equipment, food available, then don't open up the facility. It is not for optics. It is for serious healthcare, number one. Number two, I agree with Dr. Shukla that we should strengthen our current public infrastructure, and that can be strengthened and have extra beds there because that facility is a hospital facility. If you put extra beds in Sassoon and all other public hospitals in Pune, that would get strengthened and they will remain there long term. But I'll tell you what is the problem which has happened. Suddenly, when you get 50, 60,000 active cases, the whole system collapses. The infrastructure of healthcare, including personnel, has fully collapsed, and they have just been, even Mumbai did not face this unprecedented times, even in the worst of times. And I think this is very, very sad. This could have been anticipated and prevented. And I would not go by collection of fines. I think that's a very unfair way to compare healthcare infrastructure. Healthcare infrastructure has to be robust, sustainable, because COVID care is all about supportive care. It's all about giving oxygen at the right time. It's all about giving a couple of medicines and if needed, ventilator. If we treat early, treat aggressively, we can save a lot of lives. And it is very tragic what has happened. And I hope that now, adequate personnel and there are enough healthcare professionals
yes, of course
across.
It is tragic. It shouldn't have happened.
It should never have happened.
No, Dr. Shukla, does this expose, I'm sorry, I'm using a very strong word here. Does this expose the sham of preparedness? Preparedness that is talked about, that is promised, is a sham. Okay, we'll have to reconnect with you, Dr. Shukla, in just a bit here. But only further adding to what Dr. Joshi here was saying, it doesn't really help. And once again, I would like to go across to Mrs. Raikar, who in fact has keeping so much patience here in wanting to get this word out. People have been shocked with the case of her husband. He was a journalist. He was a prominent journalist. If he wasn't a journalist, if his own identity as a journalist wasn't there, he would have been just another common man here, just another name that would have been lost in this COVID crisis. The reason that this has come in as such a huge jolt because people are talking about it, people know him closely, people have been publicly mourning his passing away and slamming these jumbo facility. Let's get in Dr. Shukla. Yes, Dr. Shukla, if my voice is going through here, please. I was very specifically asking, and I apologize if this sounds like a very strong word, that all along we've been talking about preparedness. Lockdown meant for preparedness for 2 months. Post that, opening up, preparedness continues. It's a sham. There is no preparedness. If this medical emergency doesn't shake us up in making our health system formidable, what else can?
Yeah, I mean, I may not use the same words, but I agree with the spirit of what you're saying. This is a jumbo disappointment, and it is also exposing the fact that, as Dr. Shashank Joshi said, that public health services also were caught unaware because over last few decades we had neglected them. We had not expanded them. We had not upgraded them. We had not had enough specialist doctors, put in place ICU beds. As I said, not a single ICU bed exists in any of the corporation hospitals in Pune. This is the result of decades of neglect and leading to lack of preparedness. And then we have this situation where it's declared that the jumbo facility will have 800 beds and overnight 500 beds evaporate. And now we are being told there are only 300 beds and perhaps even those are not functioning. So we need to take this as a wake-up call for Pune and for Maharashtra, that public health systems must be expanded, strengthened immediately. For example,
I seriously, sincerely hope that this is the final wake-up call. There have been so many wake-up calls here in the past few months. I mean, we are literally living with our immortality every day. We have not been living with death so closely. I don't know
One,
what
one,
else will be a wake-up call. I appreciate all our panelists being with us, and specifically Mrs. Raikar. Our best wishes to you and your family, wishing you all the strength. We are so terribly sorry for your loss. Thank you everyone
But
for being
ma'am,
with us.
we want
Let's, in fact, now move on to our next issue that we're going to be discussing today. And this is regarding the rise in the cases of crime, heinous crime in Uttar Pradesh. I know each time we talk about law and order issues in Uttar Pradesh, the given sense is that nothing has changed. This keeps happening. This has been happening for years. Uttar Pradesh is a basket case as far as crime and law and order is concerned. It's never going to be improving. But the point we want to make here is, if it continues to happen year after year, government after government, 5 years after 5 years, it doesn't mean we stop talking about it, because the number of crime, the nature of crime gets only more heinous. Each given day, each time, for each government, it needs to be a jolt to fix this problem. The NCRB data, which is the National Crime Bureau, the last of which has released its figures there, stated that there is a rape that happens every 2 hours in Uttar Pradesh and a crime against a child which is reported every 90 minutes. The government of the day today in Uttar Pradesh continues to be in denial. It continues to insist that law and order is taken care of. Instead, it says that in UP, the opposition is a bigger danger. And this comes in the face of the UP DGP himself, writing in a letter to his officers saying that several of the recent crimes could have been avoided had his officers acted in on time, had his officers taken the initial complaint, the FIR, the first instance of the complaint of a case seriously. Several of these crimes that could have been avoided. There have been so many goof-ups in the recent past that the UP government, across cities, across districts, has made. Some of those we're going to be going through. But in the latest that has been reported here, this is as recent as today. Yet another case that has come in from the Lakhimpur Kheri district. A 3-year-old girl, a toddler, a baby, raped and murdered. The police has nabbed the culprit. But the police continues to remain on the back foot whenever such crime takes place, because it's guilty that it's been caught napping. The police continues to say here, in each of these crimes that are reported, that this happened because of personal enmity. The question is, what was the police doing? Let's take this through our panelists. We have with us member of the ruling party, which is in Uttar Pradesh, Ms. Anila Singh of the BJP, Arvind Kumar Jain, who is the former DGP of Uttar Pradesh, Juhi Singh, who is the spokesperson of the Samajwadi Party, and Mr. Sharad Pradhan, senior journalist. First to you, Mrs. Anila Singh here. Your first reaction to what has been happening, and this is specifically now because of the intensity of the recent cases that we have specifically seen from Lakhimpur Kheri. In the last 20 days, there have been 3 cases of girls raped and murdered. All 3 minors.
Absolutely shocking, I can say. I mean, I don't have any words for any sort of advocacy when I see such cases happening. But the unfortunate thing is that whenever the inquiry is done, the sad part is always a known person has done this thing, or somebody who has got some sort of grudge or rivalry. They take out their rivalry or grudge through the rapes, or especially if I talk about minors. But at the same time, when any person, any organization says that government is responsible for this, then I have to say that you cannot blame government for this. Like if somebody very well known to you, or somebody who has got rivalry with you, that person, he is in search of that moment when he can attack. So these people, they are arrested, they are thrown behind the bus. But the thing is, when stringent punishment is not given, when exemplary punishment is not given in time-bound judgment, then I think people think that they can do anything, and then they will get bail, they will be out, and again they can commit some sort of crime. So, yeah, government is definitely very strict on everything, not only on rapes but any type of crime in Uttar Pradesh. But the thing is, when punishment is not given in time, then I think
No, but
they
Ms.
get
Anila Singh, why
emboldened.
does the
These
government say that law and order is fine?
law and order, like it is better than yesteryears when other political parties were ruling. That is for sure. But the thing is, if we talk especially about
No, there
rapes,
has been a consistent, not at all. Please pick up the NCRB data. There has been a consistent rise in figures of crime. How is it better than previous?
no, it has improved. It has definitely improved. But you can say that still Uttar Pradesh is amongst the top line. Yes, it is. But the figures have improved, I can say so.
Okay, ma'am, I'm going to be pulling out those figures in just a bit here. But this is a clear case of being in denial. I mean, if you continue to insist that it has improved here, this is a typical case of being in denial. Mr. Arvind Kumar Jain here, former DGP of Uttar Pradesh with us. Mr. Jain, it's not just about the police making arrests, but the police being unable to stop this crime, and more shockingly, in several cases that have been reported in the recent past, the police botching up cases. The police putting out on their official Twitter handle that a missing person has been found, he is back home, whereas actually, in a few hours later, his body is found at a nearby well near his home. They're botching up on kidnapping cases. Kidnappers go away, take away the ransom, end up murdering the person they have kidnapped. These are just a few incidents of even botch-ups by the UP police. And we aren't calling these botch-ups. It is none other than the current DGP of Uttar Pradesh telling his officers so many of these crimes could have been avoided had his officers intervened in time, had his officers been alert.
This is not acceptable at all. If somebody is watching up, deterrent punishment, exemplary punishment should be given to such policemen so that a message goes down the line to the entire force that no such laxity is tolerated at all. If he is absolutely correct, if he has mentioned this, if he has passed orders, could have been prevented, then it is a duty of the senior supervisory officers to punish the police people who have not shown, who have not shown who have not taken the proper action. So action should be taken against such policemen. It is not acceptable at all. As far as Lakhimpur Kheri,
Okay, and are we really seeing enough of that?
I would like
Yes,
to
please
add
carry
that
on.
as far as Lakhimpur Kheri rapes are concerned, three rapes I think have occurred in the last month, and it's very shocking that such incidents are taking place. And in my opinion, very deterrent action should be taken against the accused, including booking them under National Security Act, Gangsters Act, and a message should go in the entire district, in the entire region, that police will not spare anyone, and very harsh will be taken, and police will come down very heavily on such criminals. Lakshmi Singh, who is IG of Lucknow range, she is herself supervising all the cases. NSA has been proclaimed. NSA has been ordered against by state
But will this
government.
happen? Mr. Sharad Pradhan, please come in at this point here. Can we have UP police taking action against its own officers here? Because at the start of each case here, it's as if the UP police is desperately trying to lay off the blame, wash their hands off any case. Immediately they would say, and we noticed this time and again, that this case happened because of a personal enmity. We couldn't do anything about it.
And they don't seem to understand that if it is personal military enmity, then all the more reason that the police should have been alert. It is not as if this personal enmity was not in the knowledge of the police. Police could have certainly prevented it. And if the present DGP is saying that, it means a lot. But the whole trouble is, like you heard Mr. Jain, how conveniently he is just trying to hold a brief for the police. He is saying that the police should be doing, and police will not spare. How the hell will the police do it? The police, the trouble in Uttar Pradesh is a lot of the district police chiefs, many of the district police chiefs are known to be thoroughly corrupt. And if you have a corrupt police, inefficiency is bound to be there. There are considerations, even in these kind of things happen even in the state capital, what to talk about these small districts. And because they remain in denial mode, as you rightly pointed out, the whole trouble with the UP police is right from top to bottom, with a few exceptions like the present DGP, for instance, who admits that there is a problem. But the trouble is that most of the officials, police officials, they love to be in denial mode, and they will try to, kind of dilute the crime whether it has happened there. Now, if you do not accept the problem, how the hell can you find a solution? You cannot. And that is what...
That's it. How do you find a solution if you're continuously in denial? Ms. Juhi Singh, I would like you to respond to this not as someone who is sitting in the opposition today, who wants to slam the current government. I want to ask you as someone who has already stayed in government in the previous term.
Yes.
With your understanding, how can this be fixed? It's not as if law and order was entirely taken care of or sorted when the Samajwadi Party was in power. It was as bad. The figures have only increased this time in the current term, but it was as bad.
See, I've been in government. I've also headed the Commission for Women and Children, the minors. So I would say the first important thing is there has to be a priority that crimes against women and children are not the same as other crimes. Like, it's a irresponsible generalization to say that rapes happen only because somebody knows someone, or the 3-year-old child in Lakhimpur, 3 rapes in 20 days. And Mr. Jain says that whosoever in Lucknow is supervising it very well. It's very shameful because you're not able to recognize the problem. The laws are all in place. After Nirbhaya, we have a huge body of law which has been enacted. POCSO, it has been modified again and again. But what about the implementation?
No, but Ms. Juhi Singh, how much did your government recognize it?
I'll tell you. Exactly. I'll tell you.
How much did your government recognize it, and what did you understand from it that the current government could perhaps learn from?
We gave them an infrastructure. We understood that women and children had to be treated differently, whether it was harassment, whether it was, they couldn't come out with their names. We established a technological-oriented 1090. We also established Dial 100, which has now been renamed at 112. Asha Jyoti Kendras, which were supposed to be one-stop centers in every district, were also sanctioned. Many of them came up. One in Gorakhpur was also inaugurated by us because it's important to understand, and a constant training of the prosecution officers, making our frontline policemen aware of the laws as to how the child welfare committees, where is their WCD department? There was a series of training which was being carried out because you had to, even the judges which were handling at that level had to take certain, a child can only represent, even if, now they're not even leaving them alive, but even to take a certain degree of put her or him through certain degree of answers and questions requires certain expertise. So the present government, the problem is first not recognizing that crimes are happening. Girl has been raped in Ayodhya today, in Bath, Rai Bareli, custodial deaths, Rai Bareli, Shravasti, Balia. These reports are coming out from everywhere. These don't require any expertise. Also the fact that unless you commit and prioritize this particular let's say sort of crime, tell your police officers that it's not as if you can only take action and arrest people later on and say that stringent punishment should be given. That is in the law. Where are your fast track courts? How many have you established? Have you made a special prosecution cell in order to
all right,
handle? Yeah.
Okay, Ms. Juhi Singh, you've spoken a lot, but the problem is it's not as if Uttar Pradesh had become a very safe state for women during the surpassed government, during Samajwadi Party. I'm sorry, that is something that you'll have to admit as well. That is something that you yourself cannot be in denial. Your leaders had made very ugly and derogatory remarks against women and the issue of rapes. That cannot be forgotten. Ladke galtiyan karenge. That statement cannot be forgotten and cannot be forgiven.
Don't even forget
Ms. Anila Singh, let's get you those figures. And these are figures that are flashing on our screens here of crime against women. And this is NCRB data. Please take note of these figures here. 2016, 49,262. 2017, it's gone up. 56,011. 2018, 59,445, which is now the highest in India ever reported. Mrs. Anila Singh, please tell me how the figures are coming down. How have things improved?
No, I was talking about overall crime rate. Like, especially if I talk about crime against women, definitely I can say that now, because of the clear instructions given by Chief Minister Yogi Adityanath ji, all FIRs are lodged. So people have become more awakened, and FIRs are being lodged. And if any crime happens with any of the women, or if I talk about minors as well. So that is why we are seeing these escalating numbers. But at the same time, I don't have any words for any type of advocacy, whether any government, any time, any state, any country, whenever I see these crimes happening with the women, crimes happening with the minors, they are shameful. And I stick to my statement until or unless stringent, exemplary punishment is not given. I think these people who love to commit crime, because they know it very well that they will be thrown behind the bars, soon they will get the bail, they will be out. So until or unless this thing happens, it becomes so difficult to control the crime rate.
Mr. Arvind Kumar Jain, this sounds like an irreparable situation. Do you think this can really not work, really not be fixed on ground? I mean, we are losing lives, we are losing children, we are losing innocent women. We are grabbing them of their innocence if they manage to survive the crime that has hit them. Is there no hope for Uttar Pradesh?
I won't say that there is no hope. Police should work in this direction. Police should work against the criminals. Prompt arrest should be made, and all possible efforts should be made to curb crime. And UP is a big state. It has always been a criminal state. We have always admitted that there is a lot of crime in UP, and the only way is to take action against criminals, not to fudge the data. We shouldn't bother. My opinion has been throughout the service that we should not bother about the data. If a crime has taken place, it should be registered. It should be registered, and action should be taken against the criminals. And we should not fudge the crimes, because if you start doing it, if you start working, if the SHO gets the message that crime should not be written and there should be no increase in crime, so automatically the crime figures will come down. But it is something worst which can happen to the police in the state.
Mr. Sharad Pradhan, this sounds very good as a textbook case. This doesn't work on ground. We have seen police gangster nexus most recently in the Kanpur gangster case here. This is textbook knowledge. I mean, we should do away with it. There has to be something else that can work on ground.
I mean, I wish people who have held top positions in the police got out of this textbook mindset, because they don't think of practical solutions. They are not ready to accept that their police is inefficient and corrupt. And unless something is done, nobody talks of that. It's a sad story that they do not want to accept. I don't know why. People sitting at top, but they have to accept that there is malaise down the line. And unless you accept it and do something to stop that, nothing can be solved. And the problem with politicians is that they do not want to accept. Now, this is a very old alibi that Mrs. Anila Singh was giving, that, crime, only when crime is registered. Every successive chief minister has done this, irrespective of party, because they all want to claim that in our regime, crime has come down. When the figures go up, when NCRB brings out these figures, you remember when you were saying initially, Mrs. Anila Singh was in complete denial mode. She was not ready to accept. When you showed her the NCRB figures, then she realized she had no defense. So there's a convenient alibi. Okay, because crime is being registered. Crime is not being registered properly even today. Even in the state capital here, I can assure you, and I know top officials who admit, yes, it's unfortunate. Unless you shell out money, you can't get an FIR lodged. Or else you exercise some influence from a top politician or a senior police official. Otherwise, you can't get an FIR lodged.
That's right.
This is the tragedy. So, the problem, the malaise lies...
Miss Anila Singh, there's this one final question I would like to ask you, please, here. Can we have the UP government listening into their own DGP of the state? If the DGP of the state has said very clearly that the situation is so bad, he's told his officers here, so many crimes could have been avoided had they acted in time. Can we have the UP government listening to their own DGP instead of saying law and order is doing very well?
It is the responsibility of DGP that he should correct his force. A whole of the police is under him. Instead of making such statements, he should show some action. And see, as whatever Mr. Pradhan says or Mrs. Juhi Singh says, I can't, I'm not going to contradict. They can say, but I have always taken the issue.
No, but Ms. Anila Singh, do you think that the DGP then is not doing a good job? Are you saying that the DGP is not doing a good job? Then should the government do something about the DGP?
See, that UP Chief Minister has to decide. I am no one to comment on that, but I can only say this thing. If DGP says that if the police force would have acted in time, many of the crimes wouldn't have happened, then he should mend it. He should talk to his officers in districts. So why this is happening? So instead of making such statement, he should see that what his police force is doing, because the intention of UP Chief Minister is very clear. He is working very hard, day in and day out. He wants to control crime and corruption in the state. But at the same time, whole of the structure has to, whether we talk about police or whether we talk about administration or any type of structure, or institutes, they have to help him. So if DGP Sahab thinks that many things could have been done, if the action would have been taken at right time, I think he should pull up his socks and tell his officers as well that yes, we need some action here.
So when will the UP government take their own DGP to task then? Because this is as clearly as saying that if he's saying this to his boys, to his officers here, it's out in public domain. Can we expect the UP government to take their DGP to task? What are we waiting for?
Can I come in here?
I cannot comment on this because he is a very senior, he is the super cop of Uttar Pradesh, and above him UP Chief Minister is there. So UP Chief Minister has to decide that what action has to be taken.
Okay. Final remark. If we could get this in about 20 seconds, 30 seconds, Mr. Sharad Pradhan, please go ahead very quickly.
Well, I would just like to point out one thing here. That referring to Mrs. Anila Singh's comment against the DGP, this DGP after a long time UP has an honest, upright DGP who has a fantastic reputation. I don't know him at all, but this is his reputation. And if he is saying this clearly reflects that his hands are tied. He doesn't have the liberty to appoint his own SPs.
So then we have to leave this in hoping that the situation gets better. We have to leave this on a very hopeful note here. The situation is very grim on ground in Uttar Pradesh, and yet we are leaving this on a hopeful note. We are hoping that more lives can be saved from heinous crime here. If the DGP here does have a reputation of being a very honest, upright officer, he's taking his officers to task here, the situation should improve. But right now, the situation is the worst in Uttar Pradesh. It continues to intensify as far as heinous crime is concerned. Don't think that we should stop talking about this. We will talk about this as long as the crime continues and the situation is not fixed. Thank you for being with us.